Good afternoon, or good morning still actually, 11:56 Eastern Standard Time. I'm Dr. Discogenic. We are broadcasting live spine surgery from Duke Spine Institute on April 29th, 2025. Our patient has two herniated discs that are causing severe symptoms in her neck pain going down into her shoulders, some headaches intermittently, and she came to Duke Spine for the Duke laser disc repair. She does not want fusion or ACDF or artificial disc. She wants no metal in her neck. So we're going to be fixing her herniated disc with the most advanced surgery in the world, the Duke laser disc repair. All right, I'm going to get started. The first thing we have to do is place a needle. So 2, 3, 4, 5, 6. I want to be a little bit more north. I've been doing this surgery now for 19 years. Our anniversary of 19 years just passed. 2, 3, 4, 5, 6. Still need to be a little bit higher. So I'm going to keep inching my way or millimetering my way further up. Her family was here this morning. I met them. Very nice family. Shot. Okay, so 2, 3, 4, 5, 6. I may want to go just a little bit more up. Now she is asleep. She has a tube down her throat. She's under general anesthesia, completely out. This surgery is done through a 4mm incision. A tiny, tiny incision. Luis, I'm having trouble seeing down here. The light.
Doctor.
You guys really need to position the light properly.
No, we need that light. More down.
Shot. 2, 3, 4. That's perfect. Okay. I'm going to start with the lower disc, so I'm going to slide down a little bit. Sean. Perfect. 2, 3, 4, 5, 6. Everyone agree? 5, 6? Yes?
Yes, sir.
All right, Sean. We're going in. If you have questions, feel free to ask them, Sean. I'll do my best to answer. AP, quick AP.
At this moment, no current questions.
Now I'm using an X-ray machine to guide the tip of the needle to its final location. That looks good. Lateral. So we're right in the middle with the tip. And we're right in the middle of the disc on the lateral view. It's perfect. So I'm going to advance it just a little bit and hold it here. I'm going to get another AP view, getting my hand out of the way. Shot. 2, 3, 4, 5, 6. So we're at 5, 6. Perfect. Yeah, that looks really good. So just a little bit to the right of the midline, which is fine. I'm going to enter the disc. We're going to do a discogram. Henry, let's show the audience how is it that these disc herniations can be so painful. But before you do that, Jordan is going to point with the mouse pointer, the white arrow, on the bones, starting at C2. That's C2, the tall one. Show us how tall it is. All the way up to the top. Keep going. Keep going. There's the top. That's C2. And then the next bone is 3, 4, 5, 6. So we're at the 5, 6 disc. Everyone agrees? And there's our discogram shot. Now look at the tear shot in the back of the disc. Right there. That's letting the dye out the back. So I'm going to go ahead and, now that we've done the discogram, we're going to place our guide wire. Shot. I think we're a little overexposed. Can you bring the collimator down and reduce the exposure? I'm going to numb up the skin. We're going to do a 4mm skin incision. 4mm. The whole surgery, folks, and while we're waiting for the anesthetic to work, let's bring the tube. And I'm going to show you how we're going to do the surgery. The whole surgery is done through a tiny tube. This is endoscopic surgery. Henry, check this out. This is our endoscopic rig. It has a camera and a scope, a light source, a laser fiber, cold irrigation. All of that, and all of it's put right through this little tube. We're going to go right to the back of the disc at 2 discs. We're going to start with 5, 6. We'll go to 4, 5 next. We're going to basically do the whole surgery through this little tube. We're not going to be taking her disc out. We're only going to be taking the herniation out in the back. This is the future of spine surgery you're watching. This is the most advanced spine surgery in the world for a herniated disc in the neck. We just finished fixing someone's lower back. That guy's doing great.
Fantastic. Yep.
He's from Mississippi.
Everybody's recovering so far.
Yeah, he's almost ready to go home. Now this lady is from Florida. I can't give you too many details for patient privacy, but she injured her neck how many years ago? Like, I think she's been suffering with symptoms for longer than 3 years. So, long story short, she's been recommended for invasive surgery. She didn't want it shot. She found Duke Spine Institute and decided to have the minimally invasive Duke laser disc repair shot. All right, I'm going to be advancing this dilator down shot. I'm going to pull the guide wire back just a little bit because I don't want it to go into the spinal canal shot. The dilator is sliding down shot, the guide wire, and heading to the spine. The dilator is a small metal pencil. It's got a hollow center shot, and its purpose is to gently spread open fibers, like muscle fibers, fascia fibers. That's what it's doing. Now it's docked in the front of the spine, and I'm going to remove the guide wire in just a moment, and we're going to advance the dilator into the disc. Now, AP, people ask me, Dr. Duke, isn't the dilator causing damage? The answer is no. The dilator doesn't damage anything. The only damage this whole surgery does is we cut the skin, 4 millimeters. That's tiny. Look at that. Very good. I'm going to move the dilator a little bit to the patient's left in just a moment. No. You go lateral. It's fine. You guys can see on that AP view the dye is leaking out through annular tears on both sides of the disc. So when she injured this disc, she injured it on both sides. I'm going to take this dilator, the guide wire out. Hold on. And now I'm going to move the dilator just a little bit to the patient's left. And let's see where we are. Shot. AP. Any questions?
Yes, we have a lot of questions. This next one, first one is coming from Thunder and Lightning on YouTube.
Let's start by first, before I take questions, I want to show the audience, because just like we do with the lower back, there are 30 distinct, different, specific causes of neck pain. If you know somebody with neck pain, they have one or more of these causes. The most common cause of neck pain is a disc injury like this patient's. All right, disc injury. So she has actually three disc injuries. She decided to fix 2 of them. I think can you please bring the window down on the front? We don't need to see that much of the front of the spine. You're just radiating my fingers. Okay, I don't want a sarcoma. That's a little too little, but get rid of the stuff in the back. What we're doing, folks, is I'm having Jordan, who's been on vacation, I think his brain is still on vacation, I'm having him adjust what's called the collimator, which is a lead plate that focuses the radiation emitted by the fluoro that gives us a picture so that it exposes less of the patient, less of the OR staff, and less of my fingers. And the problem with radiation is that there are some pretty nasty cancers that come from radiation. The most famous is called an osteosarcoma, osteomyoma. These are bad tumors. There's no cure. So I don't want any extra radiation. I want to stick around and take care of patients for a long time. All right, so he's adjusted the field, which is good. And you can see the tip of the dilator is in the back of the disc. But let's go ahead and show the audience 30 causes of neck pain, and then we'll start taking questions. Meanwhile, I'm going to be placing the first tube through a 4 millimeter skin incision. And I want to show you one last thing. Hold on. Check this out. This is the only blood we lost the whole surgery. This is it. This is basically bloodless surgery. All right, go ahead, Henry. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. We'll talk about the 30 causes of neck pain in a moment, but I want you all to see we've placed the tube. We're about to bring the endoscope and laser in to repair this herniated disc in the neck. Now, this works for bulging discs, herniated discs, protruding disc, extruded disc, ruptured disc, slip disc, spondylosis, degenerative disc disease, you name it, stenosis, this surgery works. Any problem with the disc. You can see how small the incision is. Again, bloodless. There's no blood. We didn't even lose a full drop of blood. And this patient goes home in an hour after surgery. Okay, so I'm just going to talk for a moment and then we'll take questions, okay? But
Copy that.
basically, the video you just watched, 30 causes of neck pain, highlight there are 30 specific things that cause neck pain.
Please, thank you.
The most common is a disc injury like this patient. Disc injuries are very common. Discs are weight-bearing joints. They bear 85% of the weight in the neck of your skull. And you can see the fiber there, the laser fiber. You guys see that fiber at 12 o'clock?
Yes, we do.
That laser fiber is made out of glass. It's a fiber optic instrument. And I want you all to guess how thin it is, how skinny it is. It's going to blow you away when you hear. It's 1/2 millimeter. It's 450 microns. All right? That's 1/2 millimeter, less than 1/2 millimeter. So, you want to talk about precision? This is the most, easy. This is the most precise instrument in the world for surgery, okay? So people talk about, lasers are dangerous. They're not dangerous. If the doctor who's using it has experience and knows what they're doing, they're trained properly, like here at Duke Spine, then they can use this extremely accurate and precise tool to fix your neck. This is more precise than any other surgical instrument in the world. Okay, guys, we're overexposed. Let's bring the intensity down by 2.
They're over. There you go.
Okay, this is the herniation, by the way, that I'm zapping away. It has a faint blue color. You guys see that?
Yes,
That
we do.
is the herniation. And there's not a lot of, there's a piece right there. There's not a lot of scar tissue associated with this herniation. It's because it's not that old and she just hasn't produced that much scar tissue. A lot of the herniations we see have more scar tissue because they're older. They've been around a long time. But this, what an elegant surgery this is, to leave your disc there. Now, every other spine surgeon out there is going to want to take the whole disc out only because they have no way to get to the back part besides looking through the disc with a scope or with loops. But with this surgery, because we're doing it arthroscopically, endoscopically, we don't have to take the disc out. We can leave the normal disc there. And that's what we're doing. The endoscopic part of this surgery was pioneered by a Korean neurosurgeon. His name is Dr. Sang-Ho Lee. Dr. Sang-Ho Lee is famous in Korea. He founded the first spine hospital called Woodidal Spine Hospital. He's the president and founder. He's really quite an impressive neurosurgeon in my mind. He is the first to do endoscopic cervical surgery that I'm doing right now. I learned from him directly overseas, and his right-hand man, Dr. Gun Choi. I think they're both retired now, but they trained me 20 years ago to do this surgery. Now, they didn't do the laser part, they did the endoscopic part. And they used metal grabbers, which I found to be less effective than the laser. I brought the laser in, and that's how it's the Duke laser disc repair. So it builds on technology that they've developed over in Korea. Now, they also built on technology that was developed by Dr. Parvis Kambin. Dr. Kambin was the first surgeon in the world to do true uniportal endoscopic surgery through one port, and he did it in the lumbar spine, the lower back, for herniated discs in the lower back. Dr. Kambin taught at the University of Allegheny in Pittsburgh. That's where he was a faculty, and he taught the residents, including Dr. Sang-Ho Lee, how to do lower back disc surgery through a small portal. Dr. Sang-Ho Lee then took Kambin's teachings and applied it to the cervical spine to do surgery on the neck, on cervical disc. So you can see how technologies build on each other. Pioneers. We always say in medicine we're standing on the shoulders of giants, meaning that my technology, Duke Laser Disc Repair, is built on the technology of pioneers and giants in the field. Okay? The problem in today's neurosurgery field is that the entire field of neurosurgery, the popular field, is stuck worshiping the old, ancient technologies that are bad now. They're old technologies, but these old guys don't want to give up their popularity, and they want to stay rock stars, you know? It's kind of like going and watching an AC/DC concert now. You know, back in the 80s, they were amazing, right? They were rockers, true rockers. They were awesome. Everyone wanted to see them. But now they're a bunch of old drug addicts that they can barely sing. Their music sucks. And that's what it's like in neurosurgery. I just went to the main meeting of the year over in Boston, the American Association of Neurological Surgeons. And who are they celebrating all over the place? The old fart bags. The ones that, you know, develop surgeries that like are 40, 50 years old. And they should be put to rest. I'm sorry, but it's true. Okay? Maybe someday somebody's treatments will be better than mine, and I'll be the old fart bag. But the truth is, they don't want to let go of their power and control. They're making a shit ton of money by being idolized by these young neurosurgeons, but I know that their treatments are terrible and that they're hurting patients more than they're helping. So it's really hard for me to go to these meetings and take them serious when they just keep talking about laminectomies and discectomies that we know are bad procedures, and there's better. Especially when I'm trying to teach the surgeons they're better, but they don't want to hear about it because they're too busy, you know, worshiping these old guys. Anyway, we'll take some questions, but that said, if you watch the cervical causes, 30 causes of neck pain, the most common cause of neck pain is disc injury. The second most common cause is facet injury, and disc injuries account for about 85% of neck pain, and facet injuries account for 15%. Okay? Fractures are extremely rare in the cervical spine. All right, questions?
This next question coming from, our first question coming from Thunder and Lightning on YouTube, asking, or this is a comment, even as saying, "Boy, I wished I known about you back in 2007 before anterior dissection at C5-C6 with fusion, because now I'm having more issues above and below the fusion."
Yeah, so I wish you did know about us. That's the year I started doing laser surgery in 2006. So that would have been 1 year into it. And I was doing a good job back then. But it's not too late for us to help you. Please come to Duke Spine. I can fix your neck. There's no doubt about it. I can tell you exactly what's hurting you, what's causing your symptoms. And you can do it virtually through our free MRI review. We offer a free MRI review. There's no charge to you, the patient. You get one free MRI review, either your lower back, your neck, your thoracic, whatever you want. And I will spend 10 minutes with you on Zoom, and I will diagnose exactly what's causing your symptoms. More importantly, I'll tell you exactly what you need to do to fix it. Now we have, remember I showed you guys 99% of neck pain is caused by disc problems or facet problems, right? We have the treatments now for disc problems and facet problems. The disc problems are treated with Duke laser disc repair. The facet problems are treated with Duke plasma rhizotomy. So between those two treatments, and they're only available at Duke Spine Institute, we can cure 99.5% of neck pain, okay? All right, so we're at the back of this disc right now. You can see the herniation and the tear right here, the blue stuff. Just beyond that is the posterior longitudinal ligament and the epidural space. We want to stay away from that area. That's where the spinal cord is. We don't want to damage her spinal cord in any way, but you can actually see pretty darn good with the laser and the scope. Now the laser is 0.5 millimeter wide, not like the lower back where it's 1 millimeter. This is half the diameter of the lumbar laser, so it's a smaller laser fiber. We use the same machine, but we deliver less energy. Any questions?
Yes, we got a couple more questions. Next one is coming from...
Luis, I need you to hold this here, because when it turns, remember the tube is not circular, it's oval. So when it turns, I can't get my scope down, okay? So you got to be monitoring that. Don't push it down. Just keep it where it is from rotating. Sorry, go ahead.
Not a worry. Next question is coming from Pawnlust on YouTube, asking, in your experience, is it more common to have problems at C5-6 or C7? What about L4-5 versus L5-S1?
Yeah, Pawnlust, great question. You are correct. In the lower back, the most common disc to cause symptoms is L4-5, and that's around 40, probably 45% of all back pain comes from L4-5 disc. The L5-S1 disc is the second most common, and that's around 44%. So to be honest with you, I'd give L4-5 and L5-S1 are, between the two of them, about 90% of back pain. And then you got L3-4, which would be the third most common cause of back pain, L3-4. So L3-4, L4-5, L5-S1. Oh, the other way? So those three discs account for 99% of discogenic back pain. In the neck, the most common disc that equals the L4-5 is the C5-6. That is the most common disc to cause symptoms, C5-6, followed by C6-7, followed by C4-5. Yeah, thanks. All right, this is all herniation here. We're zapping away with a laser. You can see down there, that is the herniation right here. I'm zapping it. It's the blue stuff. A lot of some scar tissue now. We're starting to see a lot more scar tissue than before, and you see some calcification right here. So this part of the herniation is the oldest. That's why it's calcified. And we're almost done with this disc, by the way. I'm just about finished. Remember, below this herniation is the spinal cord. That is not something we want to mess with. We want to stay away from it. Respect the spinal cord. Very, very important if you're going to do this kind of surgery. You cannot go near the spinal cord, period. Sometimes we have to operate right on top of it, but you cannot be bad to it. You have to be a good neighbor. Any other questions?
Yes, we have a couple more questions. Next one is coming from Frank on YouTube.
Let me just say before I take Frank's question, the tip of this laser right now, if you look at where it's inside the foramen on the left at C5-C6, okay? Inside the neural foramen. That's where the nerve root lives. And her worst symptoms were on the left side. This is the side we're on, left side. And it was coming from this exact area, right? Right where the herniation was. You see that? And I've zapped it all away. The nerve root is just below that little hole right there. And you can see all the herniation is gone, 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 gone. Okay? This is the only surgery in the world at Duke Spine. We're the only ones that do it that avoids having to do a fusion or laminectomy for you by going in arthroscopically and fixing the problem. This is a young lady. I can't tell you where she works, but she works for a very big distributing company. She doesn't want a fusion.
Next question coming from Frank on YouTube.
Yep.
Asking, Dr. Duke, do I need a prescription to get an MRI of my neck, or can I just do something like that on my own?
Yeah, so Frank, in the United States of America, you must have a prescription to get an MRI. It's a diagnostic test that requires a prescription. But if you come to Duke Spine, we can do it for you. And we offer very cheap MRIs. I think the cheapest out there. $300 for if you pay cash. You wouldn't need a prescription, but I could give you one anyway. If you do the MRI review with me and you need a new MRI, I'll give you a prescription by email. But typically your primary care doc should be able to order it. I will warn you, your insurance company will try not to pay for it. They're going to call your MRI experimental. They don't want to pay. You know why insurance companies don't want to pay for MRIs? Because they know that if you get an MRI, the next step is surgery. And they don't want to pay for your surgery. So if you ever watched the movie The Terminator, and you remember what happened in The Terminator, the machine sent a Terminator back in time to kill Reese, right? So that he never could lead the rebellion against the machines. That's ingenious, right? Well, the insurance companies took a page from the Terminators, and they decided if they prevent you from even getting an MRI, then you can't get a recommendation for surgery. So they're ingenious. But folks, it's time for you to wake up and realize Skynet is real, and they're called health insurance companies. And they have one goal in life, and that is to not pay for your care. So we've got to fight them if we want to win. If you guys want to be healthy, America is ranked 64 in the world in healthcare. We are the lowest ranking of all developed countries because the insurance companies are taking your money and not letting you have treatment. That's what's happening. And doctors, unfortunately, are too weak and pathetic to fight the insurance companies and to tell you the truth. So what they do instead is they just do what the insurance companies want them to do. Okay, doctors are afraid of getting kicked out of the insurance company's network. So they would rather recommend the bad treatments to you, the patient, the ones the insurance company wants them to recommend, rather than risk getting kicked out of the network. The network, sound familiar? Remember Skynet? It was a network of robots, AI. It's happening, folks. All right, just about done. By the way, this patient, she was amazing to me. I met her. I told her what she needed done, and she did it. And I'm like, how come you're not like fighting my recommendation? Because she actually watched videos like these surgery videos and learned. and she knew what I was recommending was the best for her. She trusted me. She believed that Duke Spine was going to do what's best for her. So I love patients like that do their homework and commit based on faith and knowledge and make the right choice. We're done with one disc. We're going to move on to the next disc. One thing I like to say, and I know there's a lot of questions, but one thing I like to say is that when I learned this surgery from the Koreans, from Dr. Sang-Ho Lee in South Korea, they were doing this surgery different than what I do, which is why my surgery is different and it's unique. One thing different was the patient was not asleep. The patients are awake. And I'm going to tell you, when I watched that surgery, it was obvious to me the patients need to be asleep. Because the woman that they were doing a disc herniation in her neck, they did a live stream for those of us learning. She was like literally squirming around the table in pain the whole surgery, just trying to get off the table. And it made it so damn dangerous for the patient, because that kind of moving around when you're right on the spinal cord, it causes spinal cord damage. And that's exactly what the Koreans had. They had numerous cases of spinal cord damage, and they stopped doing these surgeries completely. They stopped doing it completely. So I'm literally the only one in the world, along with Dr. Sebastian Reuten, who doesn't do my surgery. He does different in Germany, also a pioneer. And we're like the only ones in the world that do anterior cervical transdiscal endoscopic, which is the best you can have. This is the very best in the world. There's only literally 5 of us in the world that can do this. All right, let's take some, do we show the audience the animation on what causes neck pain from a disc?
Not yet.
And how we fix it. Let's do that. And then we'll take questions.
Copy that.
I'm going to come out of this disc and go up to the next one. I'm going to use the X-ray to guide me. All right, go ahead, Henry.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963. Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from the animation what we're doing. We are using an endoscope and laser to find a tear and herniation at the back of the disc and removing it. I have since, so you guys are watching that, I moved the dilator up to the C4-5 disc. I'm getting ready to do that one next. So one of the things the Koreans did different than me, and I learned directly from the master who invented this endoscopic transdiscal technique, is the Koreans only did one disc at a time. So I have pioneered at Duke Spine multiple discs being treated at the same time. Now to do that, you have to move from one disc to the next, and that is extremely difficult. It is the hardest part of the whole surgery, moving out of one disc and into the next. And I'm the first in the world to ever do it at Duke Spine. I did it 19 years ago, back in 2006, and I've been doing it for 19 years without any complications. Shot. There's the discogram. You can see the dye is leaking out. Let's get an AP. Remember, if you're going to do this kind of surgery and you're using navigation with fluoroscopy, which is the right way to do it, you must get AP and lateral views. You can never do just one. All right, stay there. Jordan, show us the tears where the dye is leaking out. There it is. There's one tear on the left and there's the tear on the right. See, that's what we're going to clean out right now. Those tears are the source of her symptoms. I need, yep. Any questions? Sean?
Yes, this next question is coming from Ramazan on YouTube.
Sean? Yes, Ramazan.
Asking, some other doctors say not everyone is eligible for treatment of endoscopic surgery. If need of fusion treatment must be fusion, is it correct? Because my chronic neck pain condition says I am not eligible.
Yeah, Ramazan, you have been watching our surgeries for a long time. I'm really disappointed that you would ask me that question. You know that what other doctors cannot do, Duke Spine can do. To ask me if you need a fusion because the other doctor said you can't do endoscopic, why do you think they're telling you that? They're telling you that because they don't do endoscopic, and they know that you will not get better with their surgeries. Therefore, they lure you in, like other patients, saying we do endoscopic, and then they end up recommending a fusion, saying you're not a candidate for endoscopic. They're lying to you, okay? It's called the bait and switch. Bait, they bait you in by putting the bait out, like a little animal. You smell the meat and you come to them, and then right when you get there, whoops, it's a trap, and they switch it out, and you're no longer having a meal. You are the meal, okay? Stop being a victim. I'm glad you asked me this question, truly, but I hope to God you asked me for the benefit of others, because you should know the answer already. They're lying to you. They just baited you with their quote-unquote fake endoscopic surgery when they were never planning on doing endoscopic. They were only going to do a fusion. I want to try to get a little bit further. Literally a millimeter is what I'm looking for here. If I can't get it, I can't get it safely. I just got to try. But I'm trying to get the tip of this dilator a little further along into the herniation, because the tip is inside the herniation right now. And now I'm going to use the impactor to advance the tube. Shot? Again, you must watch carefully on the fluoro. That's good. All right, I got a millimeter further, which is a huge thing in, endoscopic spine surgery. A millimeter advancement to the perfect spot makes a huge difference. Ramazan, you've been lied to. Come to Duke Spine and stop screwing around with your neck. Let us fix it. My God, if the one thing you people should learn from my videos, it's that these other doctors are not fit to treat you. You want the best, you come to Duke Spine. We don't lie to patients. We tell them the God's honest truth, and we can fix you. These other doctors lie through their teeth. How do you know a spine surgeon is lying? His mouth is moving. That used to be a joke reserved for lawyers. No, politicians. How do you know a politician is lying? Their mouth is moving, right? Now I use it for most spine surgeons, most pain management doctors. Yes, I am controversial, but I'm telling you guys the truth. You'll understand it someday. I have no reason to go on record lying to you. I'm not going to lie to you guys. I'm going to tell you all the truth. The truth is there's a lot of bad spine surgeons out there. Okay? And some of them are just doing what they were taught to do, but they need to learn the newer techniques, and it is still their fault. So yes, you should blame them. You may say, well, they're just doing what they were taught to do, Dr. Duke-Majan, but at the university where they train. Yes, they were, but I'm not doing what I was taught to do at the university. I was taught to do fusion and artificial disc. So why am I not doing fusion and artificial disc? Because this is better for the patient. That's why. And it's their responsibility to learn the new techniques and do what's better for their patients. And now, if they're not going to learn the best new techniques, like this surgery, Duke laser disc repair, then they shouldn't be treating the patients. Okay? Every doctor has limitations on what they can do. The reason why these doctors treat your spine with fusion is greed. No other reason. Greed. Okay? Laminectomy, discectomy, spinal cord stimulator, fusion, basovertebral nerve ablation, disc seal, mild procedure, framenotomy, all those treatments are bad and they should be avoided. This is a bone spur, by the way, I'm working on right now. People ask me, do you treat bone spur with laser? I just did. You saw it dissolve. All right, we got questions, so I'm going to stop talking and I'm going to start answering.
This next one is we have a comment and a question, but this first comment is coming from Frank once more on YouTube.
Hi, Frank.
Saying, I'm going to come to you for the new MRI. I'm on workman's comp. I don't have any other insurance, and workman's comp doesn't want to pay for anything. They've been fighting me for 2 years.
Yeah, Frank, are you in Florida?
That is a good
question. I wonder if Frank's in Florida, because we do take work comp at Duke Spine. The work comps love us. They may actually pay for us. We have a patient from California, work comp, right? Today?
Yes.
Oh, it's the next surgery. No, not the next, the last surgery. Sorry. We have a California work comp patient who work comp agreed to pay for his surgery here. He came all the way from California. He's being covered by work comp. They're paying. And we're doing his surgery today. He's a 2-level lumbar plus a piriformis release. So he's getting 3 things done. Okay, that is the power of work comp. Remember, workman's comp is different than any other insurance. They must take care of your injury the rest of your life. And they know that all these other doctors that do laminectomy and fusion, those surgeries do not work. And they're going to keep paying over and over 10, 20 years for more and more surgery if you have those surgeries done. These surgeries that we do work, and they love it because we get the patients back to work, like quickly. So I think, Frank, there's a very good chance that your work comp will pay for you to come here and get this done. I don't know that for sure. I'm being optimistic, but I'm always optimistic in life. I believe you should always set your sight on a goal and try to achieve that goal. That's good. That's a good goal. Don't let fear keep you from trying, you know?
Frank commented, I'm in Daytona Beach.
Oh.
My workman's comp company doesn't want to pay for anything. I had to get a lawyer. I'm finally settling my case out, so I have the cash to pay myself.
Oh, okay, yeah. Well, if you're settling your case, come see us after you settle. That's up to you. I can't advise you legally what to do, but yeah, it's very common for work comp to do that. If you have a back or neck injury, I would recommend you get at least $100,000, maybe more, $200,000. That way you can pay for anything you might need in the future. At Duke Spine, of course, we can take care of it all. Now, we do offer guarantees that our treatments work, and the guarantee can be for a lifetime or it can be for a year. You know, we have different options. And we have a lot of patients that like the guarantee. To get the guarantee, you have to pay full price, no discount for the surgery. But it is available. And with a guarantee, if you get a lifetime guarantee for your back, then whatever happens to your back, we fix it. And even if it took more invasive surgery or additional surgery in the future, we'll do it. And no charge to you. So, but you got to pay the full charge. And it's not talking about the discounted rate. You got to pay the full rate. So that can be expensive. Most of our patients don't pay the full rate. They pay a discounted rate. And that's a lot less. They pay about 25% of the full charge. So.
Next question coming from Ramon on YouTube.
Hello, Ramon.
Asking, will there be pain and soreness after this procedure, and will she need to have medication for the pain?
Great question, Ramon. There is mild pain in the recovery room. She'll be in the recovery room for an hour, hour and a half maybe. There's the herniation, by the way. That's part of it right there. You guys see that?
Yes, we do.
Literally sitting on top of her spinal cord, pushing on it. Not good, but I've got to try to get it out of there. She will have pain in her neck, deep inside, right where we're operating. She'll have that pain for about 2 or 3 hours today. She will not need pain meds, maybe just some Tylenol or Advil, muscle relaxer called Robaxin. That's what we typically give. But most patients that get this surgery, their pain is gone by dinner or by the next morning. We've got about 10 minutes left. So this is not a painful surgery. It just, for a few hours, she's going to have some discomfort, but not pain. And she's going to not need narcotics like you would if you had a fusion. Boy, look at all that. That's all part of the herniation. Some of it's actually cartilage off the end plate. Just came right off. Oh, so much. This is scar tissue here from her herniation and all the inflammation. This disc to me looks worse than the last one. This is number 4-5. 4-5, when I look here, I'm seeing worse than the 5-6. Here's a big piece of herniation right there. You see that?
Yes, we do. We have another question
Okay,
coming from Smallville1219 on YouTube,
sure.
asking, I have an L4 to L5 herniated disc, 13 millimeter and an 8 millimeter L5 to S1 with spinal stenosis. Would this surgery help?
Yeah, this surgery will fix your problem, for sure. But obviously not on your neck, but on your back. What I recommend you do is do our free MRI review to get a official diagnosis of what's wrong by me. I'm the one who does the MRI reviews. And then you'll know exactly what needs to be done. This, folks, right here, all this stuff I'm working on is herniated disc that is literally scarred down to the posterior longitudinal ligament. Okay? The posterior longitudinal ligament is the last barrier in front of the spinal cord and the dura, and that's what you're seeing right there, that white fiber. You guys see it? That white fiber right there, that is the PLL, posterior longitudinal ligament. All right, so this herniation is literally stuck down to the PLL. And that's why she's had so much pain, because all the pain fibers in the PLL have been activated by this herniation, by the inflammation from the herniation. Just about done. I need just a few more minutes, 2 more minutes, 3 more minutes. We should be done. This is definitely the harder disc to fix. I'm going to flip this thing. And we're going from side to side in the back of the disc, you know, trying to get all the herniation out. I've told you guys before, the doctors, we cannot get 100% of any herniation. It's just not possible. The best we can do is usually 60, 70, 80. I would say 80 is the very best. I've never been able to get 100. Nobody in the world can get 100 because the disc fragments are scarred down and your corridor or your viewport is limiting, always limiting. It's called your surgical window or channel, whatever you want to call it. Your operative window is always going to be limited by the anatomy of the patient. So normal anatomy you don't want to damage. All right. Here's a little piece of herniation, doesn't want to float up and out. Here we go. Come on. Come on. I'm going to have to use the grabber to get it out. It's too dense. Any questions?
No current questions, so we do have a comment following up from Frank once more on YouTube saying, after 2 years now, I went from being able to walk to now I'm in a wheelchair. They did pay for ACDF surgery, and they had to be forced to do that in court.
Yeah, you're right. Work comp insurances are typically just dirt bags. They're insurance companies that don't want to pay for your medical care. They're just like the other ones, Cigna, Aetna, United. They're not much different, to be honest. All these insurance companies, their ability to say no should be taken away. And honestly, if they say no to a patient, to a doctor who wants to fix a patient, and they are found to be wrong by saying no, if like you have a trial or something and then the jury decides the insurance company should not have said no, then they should be punished and they should lose their ability to say no in the future. They should be financially punished because they were just trying to keep the money for themselves, and they should not be allowed to say no to a patient in the future. That's what should happen, okay? Because that would disincentivize them from saying no. They would be very careful about saying no. And they wouldn't just say no to everybody like they do now, because there's no punishment for them, right? All they had to do is pay for your surgery, right? So when you won in court, they wasted all that time, they made you suffer, and they probably caused further neurological damage to you by not covering your surgery. And in the end, you suffered permanent damage, and they have nothing but they just had to pay for your surgery. That's wrong. They should not get away with that. That is, our system must be changed to hold these insurance companies accountable so they can't deny treatment. And if they do, and then they're found that they wrongfully deny treatment, there must be punishment for them. Just like any other criminal gets punished. Or child. We all grow up with punishment for being bad. Why should they get away from being punished? I think the punishment would work to get them to not deny treatment in the future unnecessarily or wrongly. But right now there's no accountability for any insurance company in America. There's no punishment. They wrote the law that way, by the way, so they could not be punished. All right, we're just about finished. I got 1 minute left, and then we'll be done. Our next patient has the same problem, herniated disc in her neck. She's also from Florida, but she's a 1 level. She has 1 bad disc, not 2. This one had 2. There's a piece of herniation right there. I got to grab it out. Any other questions?
Yes. We have a comment. Yes. Comments coming from Frank once more on YouTube saying you need to get the Grabzilla out to grab the herniation that won't float out.
Frank. You must have watched an old one. We don't use Grabzilla very often. So Grabzilla is a tool we use for lower back, not for neck. And it's a gigantic grabber. It's really good at grabbing onto pieces of herniations and pulling them out, but only special kinds. And it's done without endoscopic guidance. In other words, I have to take the endoscope out in order to do it, and I'm not seeing what I'm doing. So it does create a little bit of risk for the patient when I use Grabzilla. So I only use it as needed. All right, folks, we are done. And if there's no more questions, I'm going to wrap this up. But I want to show you real quick. The incision is literally 4 millimeters. We're going to put a little, are we doing, no, we're not doing staple. We're just putting a series strip. So we're going to put a little strip of tape, and then she's going to go to recovery and then go home. But this is outpatient surgery. There's no metal. There's no fusions. There's no cadaver bone or biologics. It's natural. I'm going in with a laser to clean up the tear where the herniation is, get rid of the herniation, and that way her body can actually heal the wall of the disc called the annulus and seal it. And 99% of our patients never have a reherniation. Only 1% reherniate. She's not going to reherniate. There's the incision. We've lost probably like 5 drops of blood the whole surgery. So great surgery, never had a complication. I think we fixed both discs. The one that I just finished, C4-5, far worse than 5-6. A lot more scar tissue in there. So clearly an older herniation. The newer one being 5-6. But I'm happy with the result, and I think she's going to do fantastic. All right, any other questions?
At this moment, no current questions.
All right, we're going to end the stream. We'll be back in, say, 30 minutes or so with the next Duke Laser disc repair.